Hi, my name's Emily. I'm going to be the nurse practitioner who's doing your full head to toe assessment today. Can you introduce yourself with your full name and date of birth, please?
Zach Seach, December 23rd, 1993.
Okay, and then can you tell me where we are right now?
The doctor's office.
Alrighty, and can you tell me the date, including the day, month, and year?
Tuesday, August 16th, 2022.
Very good. Have you recently had any abnormal agitation, sadness, depression, or anxiety?
No.
Okay. At this time, I'll note that the patient is demonstrating appropriate hygiene. He has good posture. His affect is appropriate. I will also note that his speech is intact, and we will move to our skin assessment. I'll note that the patient's skin is appropriate for ethnicity. He has appropriate texture. It is warm and dry and smooth. Hair distribution is even bilaterally. The patient has brown hair. I will check the scalp and note that there is no patches or lesions on the scalp. Alrighty. Also at this time, I will assess for nail bed clubbing. If you could just make, very good, and show the camera. And there's no nail bed clubbing noted. Okay, so we'll move to our scalp assessment. I'm gonna start, I just inspected the scalp, so now we'll move to palpation. I'm gonna start at the front, move to the back, and just note if there's any tenderness or masses. Okay, while assessing the scalp, I'm gonna stop at the mastoid process and note that there's no tenderness there. Also, I will note that there is no redness or swelling on either side. So for the face, I'm going to note that the patient's facial features are symmetrical on both sides. His eyes are the same height. There's no drooping of any eyelids or ptosis. He has no tics, no abnormal facies. His eyebrows are equal on both sides. They're the same length. Also, I'll assess the nose. The nose is symmetrical. Nares are appropriate size, and there's no drainage or anything coming out of them. Can you just tilt your head up? Also, I'll note that the septum is midline with no deviation. Alrighty, move into the lips. I'll note that the patient's lips are a nice pink normal color. There's no chapping of the lips noted. They're symmetrical, no abnormal swelling or edema of the mouth from the exterior exam. Alrighty. So we'll move to the neck now. Can you just stretch your neck out for me? Okay, I note that the patient doesn't have any, you can relax your neck, any webbing or abnormal skin folds of the neck. I'm also going to assess the patient's trachea. Okay, so go ahead and just look straight. And I'll note that the trachea is midline with no deviation. Can you go ahead and swallow? Okay, and the hyoid process moves appropriately with swallowing. During that time, I also assess the thyroid gland. There's no swelling or tenderness of the thyroid gland as well. We'll go to our lymph node assessment first. I'm going to assess for the preauricular, the postauricular, occipital, sternomastoid, posterior cervical, anterior cervical, supraclavicular, submandibular, and submental. And during that time, I did not note any swelling or tenderness of any of the lymph nodes. We'll move on to our vision assessment. So first we're going to do a Snellen chart. So I'm going to have the patient stand distance away. That's good. Okay, so here's my Snellen chart. Go ahead and read. Cover your right eye and read where I'm pointing.
E, L, T, F, P, H, O, L, C, F, D, H, J, B, S, E, F, T, E, O.
Okay, go ahead and switch eyes.
E, L, T, F, P, H, O, L, C, F, D, H, J, B, S, E, F, T, Z, O.
Okay, go ahead and have a seat for me. I'll note that the patient had 20/30 vision in each eye. Okay, so now we will move on to our eye exam further. I'm going to note that the cornea is intact, normal color with no abnormal vessels. There's no drainage from the eyes. There's no swelling or redness or foreign objects in the eyes. Pupils on external examination are equal and round, and his irises are brown and also equal. So we will move to our ophthalmoscope exam. Okay, just look straight ahead into the light, okay? Okay, and we'll do the opposite as well. Okay. All of the internal structures of the eye looked appropriate. I note that the optic disc was intact. Because I had the patient look directly into the light, I can note that the macula is intact. His vessels were appropriate, with veins being bigger than arteries. And there's no cotton wool spots or AV nicking in the eyes noted. We'll move to the ears. I'm going to assess the auricles. So I'm going to palpate down the ears. Note that there's no abnormal swelling or redness. I will note that each earlobe has nodules on it bilaterally. There's no swelling or lesions on the ears. Now we'll assess the auditory canals. I'm going to pull the pin up and back for the adult assessment. Okay, well, actually we'll do both sides. Okay, well, in both of the ears, I'll note that the tympanic membrane is nice and pearly white. The auditory canal is pink with no abnormal redness or swelling. There's no abnormal objects in the ears or drainage noted, and no excessive wax accumulation. So our ears are intact. Next, we'll do our hearing portion of the ear exam. I'm going to have the patient cover his right ear, and I'm going to say 3 words, and just go ahead and I'm going to whisper 3 words and go ahead and repeat them back to me.
Table, fork, spoon.
Okay, good.
Flower, window, coat.
Okay, so a whisper test is normal. Next, we'll move to our Weber exam. I'm going to place this on your forehead, and let me know if you can hear the sounds in each ear equally.
Yes.
Okay, so Weber test is normal. Then we'll move to our Rhines test. Let me know when you can't hear this anymore.
Now.
And this one.
Now.
Okay, and that is appropriate, and we'll do it on the other side as well. Let me know when you can't hear this anymore.
Now.
And this.
Now.
And that is appropriate. Just a little bit of a further assessment with our mouth. I'm going to have the patient smile. I'm going to note that the teeth are all straight, nice and white, demonstrates good oral hygiene. Also note that there's no missing teeth or loose teeth. I'm going to have the patient open his mouth and say, ah.
Ah.
All right, and I will note that the uvula is midline and moves appropriately, and also that the tonsils are intact still, in appropriate size, color, and shape. Go ahead and lift your tongue to the roof of your mouth. Okay, and both of the upper and lower palate are intact. Also, while I was in there, I noted that the tongue had no ulcers. It was symmetrical on both sides and had appropriate movement as well. Okay, since the patient's already in his sitting exam, or sitting posture, we're going to do our cranial nerves first. First, we're going to test the olfactory nerve. Go ahead and cover your right nostril. And tell me what you smell.
Garlic.
Okay, and switch. Tell me what you smell there.
Garlic.
Okay, and that is appropriate. That's garlic. We're going to do our optic nerve. So I'm going to have you cover your right eye. And then tell me when you can see my fingers.
Now. Now. Now.
Okay, and then tell me how many fingers I'm holding up.
2, 3, 5.
Okay, good. And then we'll do the same on the opposite eye.
Now. Now. Now.
Okay, and then tell me how many fingers I'm holding up.
2, 3, 5.
Okay, so our optic nerve is intact. The next assessments are going to assess our cranial nerves 3, 4, 5, and 6, with an extra assessment in for our cranial nerve 5, which is our coronal nerve reflex. So first, I'm going to have the patient fixate on an object in the distance and look straight ahead at it. And again, I'm going to note that the patient's pupils are equal, round, and reactive. Now I'm going to test for accommodation. Go ahead and follow my finger to your nose. Okay, and accommodation is appropriate. Now we're going to test the 6 cardinal fields of gaze. Follow my finger. Okay, and all 6 cardinal fields of gaze are intact. And then I'll have you close your eyes. Tell me when you can feel my finger.
Now. 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 Now.
Good. And then I'm going to use, we'll use the bottom of our reflex hammer for pain sensation. Tell me when you can feel.
Now. 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 Now.
Okay, good. So sensation is equal on both sides of the face. So that is appropriate. Now we'll move to our facial cranial nerve. Go ahead and wrinkle your forehead. I'm gonna have you turn a little bit. Okay, perfect. Go ahead and wrinkle your forehead. Flex your eyebrows. Close your eyes real tight. Okay, you can relax your eyes. Go ahead and smile. Make a kissy face. Make a silly face. And stretch your neck out again. Good. You can relax. We just assessed our vestibulocochlear cranial nerves with our Rhine and Weber tests, and those were intact. And we also assessed our glossopharyngeal cranial nerve by having the patient open his mouth and say ah, where we noted the uvula is midline and moves appropriately and is symmetrical. During that time, we also assessed our vagus nerve. Next, we'll assess the accessory nerve. Go ahead and push up on my hands. Okay, good. And the accessory nerve is intact. And finally, we're going to do our hypoglossal. So go ahead and stick your tongue out. Move it side to side, up and down, and in and out. Okay, so hypoglossal is intact. Now we're going to move to the assessment of our extremities, of the patient's extremities. So I'm going to have you stand for me. Okay, so go ahead and flex your elbows up and don't let me push them down. Okay, put your hands to the side. Don't let me push your hands out. Good. Go ahead and put your hands flat. Don't let me push them down. Awesome. Okay, so all of his upper extremities are intact. Oh, and then we're also going to do our rapid alternating movement. So go ahead and put your hands flat on mine and flip them like patty cake as fast as you can. Very good. So that is intact and appropriate. I'm going to have the patient start at his nose and move from his nose to my finger repeatedly. Okay, we'll do the same on the other side. All right, very good. And then go ahead and from your pointer finger to your pinky finger, touch with your thumbs and back. Awesome. Okay, it's all intact. So we will do the lower extremities now. Sit. Okay, so first we're gonna assess the legs. I'm gonna lift the leg and have it fall to gravity. So just relax, and it falls to gravity appropriately, and falls to gravity appropriately. I'm gonna assess the patient's gait. So just really quick, I'm gonna have you walk normally across the room. And then on your way back, walk on your tiptoes. And then walk on your heels back to the window. Go ahead and stop there. We're going to assess the Romberg test. Close your eyes with your feet together. I'll note that the Romberg test is good and his balance is good. Go ahead and open your eyes and walk back to the chair, one foot in front of the other. Okay, so go ahead and sit. So gait is normal. I'm going to test sensation of the lower extremities as well. So I'm going to start at the ankles and move up to the knee. And tell me when you can feel it.
Yes. Now.
Good. We'll assess on this side.
Now.
Okay, and then while I'm down here, I'm also going to do a Babinski side. I'm going to start at the heel and move to the ball of the great toe. And I'll note that there's plantar flexion. And again, plantar flexion on both sides. Okay, fantastic. So now we're going to test deep tendon reflexes. For now, I'm just going to assess the extremities, and then once I have the patient in a laying position, I'll assess his abdominal deep tendon reflexes. So first, I'm going to start with the bicep. Good. This is the brachioradialis. Tricep. We'll just go down each side. Patellar. Good. And then we'll do the ankle. Okay, and then we'll do the same thing on this side. So bicep, brachioradialis, tricep, patellar, and the ankle. Okay. So all of those deep tendon reflexes are intact. And then I'm also going to assess for ankle colonists. So I'm going to just force dorsiflexion on each of the feet, and we'll assess if there's any pain. No pain?
No pain.
No pain. All right, great. Okay, so now we're going to move to the patient's musculoskeletal exam. Throughout the exam, each joint I assess, I am going to be inspecting for any redness, bone displacement, any abnormal swelling, or pain with motion. So that will be done throughout the entire assessment. I'm going to start with the patient's fingers and wrists. So go ahead and stick your fingers out for me. I'm going to note that the patient's fingers are symmetrical on both sides. Palpate down each of the fingers and note that there's no nodules or abnormal masses on the fingers. And they're all intact. I'm going to have the patient flex his fingers up, and then I'll have him flex his fingers only down. Open them wide and together. Great. And then we're going to do the same with the wrists. Go ahead and keep your hands out. I'm going to assess the ulnar and radial heads at this time, and note that they're intact with no pain on palpation, no tenderness or swelling, and the surrounding muscles are also intact. And the patient flexes his wrists up, his wrist down, internal and external. Okay, normal flexion, extension, abduction, and adduction of the wrists is noted. I'm going to palpate the anatomical snuff. I'm going to have the patient lift his thumb, and I'm going to palpate into that notch. Any pain?
No.
Any pain?
No.
Okay, also I'm going to assess for carpal tunnel. Any pain?
No.
Any pain?
No.
Okay, go ahead and stick your thumb inside of your fingers and flex down. Any abnormal pain?
No.
Okay. So no carpal tunnel noted. And then while we're on the wrist, we'll also do an Allen's test. That's when I'm going to occlude both of the arteries in the wrist and release them one by one to make sure that color comes back to the hand appropriately. So positive Allen's test on the left. And positive Allen's test on the right. Okay. Now we're going to move to our elbows. I'm going to assess the elbows. I'm going to note that the medial and lateral epicondyles are intact. There's no abnormal displacement of the elbow bones, and all the surrounding muscles are also intact. I'm going to have the patient flex his elbows, extend. I'm going to have you flip your hands up and palms up. So that's good pronation and supination. And then I'm also going to have you turn your elbows in and flex them out. Very good. So our elbow assessment is appropriate. I'm going to move to the shoulders. I'm going to start at this the notch, and I'm going to move out the clavicles to the shoulders. Okay, I'm going to have the patient lift his arms up to his sides. Okay, you can relax. And I'll note that there's normal movement of the shoulders, and the surrounding muscles are also appropriately intact. Okay, so now I'm going to have you lift your shoulders up to your sides, and then I'm going to have you scratch the back of your neck with each arm, and go ahead and reach for your opposite shoulder with each arm as well. Good. And okay, perfect. We'll assess the neck, which we kind of did already, but we'll do it again for our musculoskeletal portion. Now the patient touches chin to his chest. Lift your chin to the ceiling. Look to the right and look to the left. And then make your head go in a circle. Good range of motion in the neck. No abnormal skin folds during that or muscle abnormalities. Okay. We're going to move to the spine. So for this portion, I'll have the patient stand. I'm actually going to have you stand sideways. Okay. So I'll note that there is good, nice S curvature of the spine. I'm going to palpate each of the vertebrae just to assess for any abnormal placement of the vertebrae or splinting off. And I'm also going to assess at the sacroiliac crest. Now I'm going to start again and assess the muscles on the sides of the spine. And all of them are intact with no abnormal displacement. Go ahead and bend at your hips. I'm going to note that the spine is nicely aligned. Also, while the patient's in this position, I'm going to note that the hips are also aligned. Can you put your hands on your hips for me? Awesome. So they are both equal on both sides. Okay, you can stand. Go ahead and face the camera. Have you twist. Good. And that's good. And then you can bend to each side. All right. So good range of motion in the spine. All right. Now we're going to assess the hips. I'm going to have you turn back to your side. I'm going to have you kick out and kick back. All right. And then go ahead and kick to the side and then come across your body. All right. And we'll do the same thing on the other side. All right. Hips have good range of motion. So we're good on that. All right. We'll have you sit back down and go to your knees. I'm going to assess the knees, so I'm going to have the patient extend his knee out and back, best you can, out and back, and then go ahead and internally rotate and external. And the other side as well, please. Good. I'm also going to palpate each knee, and I'm going to note the tibial and the femoral heads and the patella during this time. Okay. All right, so there's no abnormal tenderness, redness, or swelling. All the muscles surrounding this joint is intact. The patella is in proper placement, and I'm also going to do posterior. And there's no tenderness or abnormal masses behind the knee either. So now we're going to move to our ankle. I'm going to have the patient lift his feet up and down. I'm sorry, just at the ankles. And then in and out. Also going to palpate around the ankles, make sure there's no abnormal swelling or pain on palpation. And I'm also going to note ankle collinus, so I'm going to force dorsiflexion. Any pain?
No.
Any pain?
No.
Okay, great. So that is all for our musculoskeletal. Okay, so now we're going to do the patient's blood vessel exam. Before starting the exam, we did get a baseline set of vitals. His blood pressure was 120 over 78, heart rate was 60, respiratory rate was 20, and his temperature was 98 for time management purposes. With the patient laying, I'm going to assess his chest and his abdomen. I'm going to note that there's no abnormal pulsations. The patient has equal and rise and fall of his chest. There's no use of any accessory muscles. I'm also going to assess first in the laying position the jugular vein, and I'm going to note that there's not any distension there. And the patient turned his head to the right. No jugular vein distension, and turn his head to the left. And again, there's no jugular vein distension. I'm going to palpate the carotid arteries at this time. I'm going to do them each separately. I know that there are +2. I'm also going to assess the fifth intercostal space, midclavicular line. I'm going to assess the apex. First, I'm going to palpate with my fingers and note that there is a good pulse present there. And I'm also going to assess with my palm. Go ahead and hold your breath. And I'll note that there's no thrills palpated as well. All right, so we're going to assess all of our pulses at this time. So I'm going to do the temporal since I missed that in the face exam. And I'll also auscultate over the eyebrows at this time. Okay, his temporal are +1. We assess the carotid. I'm going to move to the brachial. Both are +2. Assess the radial. +3. I'm going to palpate the femoral. I'd say those are +2. Go ahead and bend your knees up for me, just a little bit. I'm going to do the popliteal. And those are +2. We're going to do the dorsal. Okay. And I'm also going to do the post-tibial. All right, so all his pulses are palpable and intact. Now we're going to auscultate. I'm going to auscultate each of the pulses I just palpated. I'm also going to auscultate the iliac, the renal, the femoral pulses. And the aortic above the belly button. So pulses are all intact with normal rate and rhythm, and then I'm going to go through each of them again with the bell of my stethoscope and note any bruits. Okay, no bruits are noted. During that, I was assessing down each of the extremities. I'm noting that there's no abnormal warmth or swelling, especially at the ankles. Hair distribution is appropriate, and there's hair noted on the patient's toes. And that is all of that. So now we'll move on to our abdominal assessment. Going to note that there's no stretch marks or scars on the abdomen. It's flat with normal pigmentation. So we start the abdominal assessment with auscultation. So I'm going to listen in all 4 quadrants in 2 places. Right. And all of the quadrants have active bowel sounds. I'm also inspecting the belly button at this time. I'm noting that there's no redness or discharge coming from the belly button. And also during this time, I'm going to go back and do my abdominal reflex. So I'm going to lightly palpate each of the abdomen, make sure there's not any abnormal flexion on palpation. Good. And go ahead and lift your head up. I'm also going to note that there's no masses or hernias or splitting of the muscles when the patient flexes neck. Okay. You can relax your neck. Alrighty. So now we're going to palpate the abdomen. I'm going to start with light palpation. I'm going to start at the bottom and work my way up. Any pain? Also going to assess the patient's facial reaction to see if there's any pain that he may be denying. Okay, so good light palpation, then we'll do deep palpation. Okay, no pain or tenderness noted on either of those. I'm going to percuss the abdomen, or percuss in 2 spots in each of the quadrants. Okay, there's no abnormal masses or dullness heard throughout the abdomen. Alrighty, so now we're going to assess our liver. The liver is on the right side of the abdomen. I'm going to assess underneath the patient's rib cage. While I'm in there, I'm going to assess the upper and lower borders of the liver. Go ahead and hold your breath. Okay, so there's no abnormal liver displacement, and I want to the liver span from the borders is 3 centimeters, which is appropriate. Also during that time, I was palpating for the gallbladder, which is non-palpable, and that is appropriate. We'll switch to the left side of the abdomen, and I'm going to assess for the spleen. Hold your breath. Okay, and then there's no abnormal displacement of the spleen either, or spleen enlargement. I'm palpating the aortic above the belly button. As well. Okay, so now we're going to move to our cardiac and our respiratory portion of the exam. So again, I'm noting that the patient's chest is normal contour, shape, size, and has appropriate movement. I'm going to palpate the chest. I'm going to note the sternal borders. I'm going to note the suprasternal notch, and I'm also going to note the apex at this time. And everything's intact with no tenderness. We're going to auscultate. I'm going to auscultate the pulmonary area, the aortic area, the Erb's point, mitral, and tricuspid area. I'm going to go through and listen to them with the diaphragm of my stethoscope, and I'm also going to listen for bruits with the bell of my stethoscope. Okay, can you take a deep breath and hold it? Okay, you can relax. No murmurs are noted, and also S1 and S2 are appropriate with no extra or abnormal heart sounds on auscultation. I'm going to have the patient turn to his left side. While on the left side, I'm going to again assess the jugular vein for any distension or abnormal pulsations, which you can see there's none present. And then I will go through all those points I just auscultated again, listening for normal heart sounds as well as any murmurs. Okay, again, I will note that there's normal heart sounds and no murmurs noted. If there was, I would describe the murmurs at this time. Now I'm going to have the patient sit. Alrighty. And one last time, we're going to auscultate all 5 of those points, both for normal heart sounds as well as any murmurs. Hold your breath. Okay, you can relax. Okay, normal heart sounds noted, normal S1 and S2 while holding breath, and no murmurs noted on that assessment. Okay, so again, I will note that the patient has normal chest rise and chest fall. There's no use of accessory muscles with respirations. I'm going to palpate the lungs first. So first I'll palpate anteriorly. Go ahead and lift your arms. I'll palpate laterally. I'm going to palpate posteriorly. And there's nothing noted. We'll percuss. Okay, we'll percuss. Laterally. Posteriorly. Okay, no abnormal sounds are heard on percussion. Now auscultate the lungs. You lift this arm for me. Just take nice big deep breaths for me. Nice big deep breaths. All right, all lung fields are clear. No abnormal rhonchi, wheezing, or crackles throughout the lungs. Everything sounds really good. Alrighty. Now I'm gonna have the patient sit on the edge of this so you guys can see his back. Okay, so first I'm going to measure for chest exertion. I'm going to have the patient take a deep breath. And I'll note that my fingers expand appropriately with the skin. And I'm also going to do that with our measuring tape here. Okay. Go ahead and take a deep breath for me. Try it one more time. Okay. And I'll note that the chest exertion is about 3 centimeters during that assessment. While the patient's back is to us again, I'm going to palpate the kidneys. I'm going to palpate at the costovertebral angle for any tenderness of the kidneys. Any tenderness?
No.
Okay. And that looks good as well. Our last auscultation for the lungs is I'm going to assess for vocal resonance. Go ahead and just say your name.
Zach.
Okay. And his vocal resonance is appropriate. And that's all for our final head to toe exam. Thank you.